The current model for funding social care is not fit for the future. Under this model, care is funded through the taxes paid by working-age people. Take the cases of generations A, B, and C. Working-age people in Generation B finance the care of those in Generation A. Tax revenue raised by Generation C funds the care costs of Generation B. This model only works, however, if the level of care needed by each generation stays relatively constant over time. People are living longer, fertility rates are dropping, and the number of pensioners is increasing. This means that there will be less working-age people to support the social care system. Therefore, younger people of working age will need to transfer more income to fund the preceding generation. The old age dependency ratio, a measure of the proportion of pensioners with respect to the working age population, is on the increase and projected to rise by 21% between today and 2040. This doesn't take into account, however, that some people might decide to work until later in life and continue contributing to the economy. The increase in the demand for care is not only due to people living longer. Those below 65 are increasingly demanding more care. It is expected that by 2024, the number of working-age adults with substantial learning and physical disabilities will increase by 11%. This will put further pressure on the system. An aging population creates important challenges to the long-term sustainability of public finances. The Office for Budget Responsibility predicts that age-related expenditure in the UK will drive debt to over 200% of GDP by 2050. Reforms research shows that pre-funding could help deliver a more sustainable model for the future. Pre-funding is not about each person saving for their own care, but about each generation setting aside money to fund their collective care needs. One of the key features of a pre-funded system is risk pooling. By pooling everyone's contributions, risk can be shared across the population. This helps account for the fact that some people will need care more than others. A pre-funded system can also increase intergenerational equity. This means that rather than relying on future generations to fund their care costs, each generation pays for a larger proportion of their care. The system might also improve transparency, as the money is ring-fenced to pay for future care costs. Working-age people contribute a percentage of their income into a later life care fund, with their contribution matched by their employer. The money is then pooled into a government fund, with the management outsourced to the private sector. Contributions are then invested and left to appreciate before being used to fund the care of those who contributed. Implementing the later life care fund. First of all, compulsion is necessary. As people age, it is likely that they will need social care. However, estimating how much care will be needed is very difficult. Without mandatory pre-funding of social care, some people might not see the need to save for the future or insure themselves against future care costs. Decisions will need to be made regarding how much money is invested into the fund. Germany provides a good comparison. Both Germany and the UK spend a similar proportion of their GDP on long-term care. Additionally, since 1994, Germany has successfully implemented an insurance-based system for funding long-term care, with employees contributing 2.5% of their income into a fund. In the UK, a similar system would mean that the average employee would contribute £31 per month, matched by their employer. Another important question is how to fund the transition generation, those who will start pre-funding their care but still be contributing through the taxation model. We propose that this is funded through a combination of equity release and by scaling down overly generous pensioner benefits. Pre-funding would deliver better value for money. Reform's research shows that for every pound paid through the current system, a pre-funded model would only require 82 pence.